Okay, so hi everyone. My name is Jarel, and today we will be discussing cancer and physical therapy. I'm trying something new, so lagi nyo na akong naririnig sa mga voiced over PowerPoints. Most of them, sa mga narinig nyo would be 2019, I think, 2018. 2020 na, let's try something new. I'm currently recording the map with different PowerPoints. Para medyo nag-stream pero lecture. So I hope um this format helps. Para hindi naman yung parang nakikinig lang kayo tapos meron kayong view ng PowerPoint. Para meron kayong parang ibang feedback at parang synchronous session pero pwede niyong ma-replay ng ma-replay. I'll try to edit yung videos kung magkaroon man ng mga minor hiccups. And I hope you just understand the topic. And kung may questions kayo, you can always ask me afterwards kapag natapos niyo na yung lecture. Dahil hindi ko ma-chop-chop, medyo magiging lengthy yung video. So I'll try to um, cut them in a few pieces. Sana mas digestible yun. Kasi medyo marami tayong mag-discuss about cancer. Alright? So, today's topic will be about cancer and physical therapy. This will be an evidence-based approach to physical therapy treatment or palliative and hospice care for patients. Lahat ng information natin ma hindi lang to limited sa cancer in general, pero lahat ng mga long-term na limiting na disease or illness, debilitating illnesses, and probably end-stage diseases also. Pero magpo-focus tayo doon mismo sa cancer treatment. Okay, let's start. Few disclaimer before we start. This evidence was searched only for about a month, from September to October 2020. I tried my best to distill a lot of journal references, plus some book references also. So for the book references, meron na tayong PowerPoint presentation from Sir Caliado and Ms. Redublo's PowerPoint noong 2018. So, yun yung main reference natin for the PowerPoint. Dinistill nila yung Goodman and Delisa at that time. So, what I did was distill naman yung evidence na readily applicable sa mga discussions na magkakaroon tayo, especially with plan of care and specifics for the protocols that you might want to do for patients with cancer. All right, so I hope this helps. A few of our objectives will be after this session, the learner must be able to apply the guidelines ng cancer-related physical symptoms based on updated evidence and their specific treatment necessities. Understand the complexities of cancer management and the general principles in palliative and hospice care for long-term diseases, and identify effective treatment strategies based on the evidence base. I'd also like to enumerate the precautions necessary for cancer treatment during different stages of the care and the disease. Create a plan of care suited for patients with cancer, and synthesize evidence-based the evidence base for the management, cancer management of physical therapists. So that's it. All right. Let's start with a brief overview. So we know that cancer is one of the 10 leading causes ng mortality or death, at least for the Philippines. So number one pa rin, yung non-communicable diseases, the heart, vascular system, top siya. So madami ang mga patients na merong cancer. And for just a distributed model for male and females, may kita natin na more females ang nagkakaroon ng malignant neoplasms or cancer. So cancer is a term used for diseases in which abnormal cells can divide without control and are able to invade other tissues. This refers to a large group of disease characterized by uncontrolled self-proliferation and the spread of abnormal diseases. Cancer cells can spread to other parts of the body through the blood and lymph systems. So basically, meron tayong normal cells, tapos magkakaroon ng new cell growth na mayroong abnormal differentiation, specifically on one part of the body na yun yung parang naging cause. So dun siya nagaling. Ngayon, kapag nagta-travel na yung mga new cells na yon, that's what we call metastasis. And usually they travel through the blood and lymph system. Kaya kadalasan yung mga cancer stages natin depende sa paglaganap niya, depende on the lymph. So dun yung staging. So cancer, depende yung severity niya on the amount of differentiation. So differentiation is the process. Its severity depends on the amount of differentiation that the new cell has. So, for example, usually differentiation ang ibig sabihin lang naman kasi nun, it's a normal process by which normal cells undergo physical and structural changes as they develop to form different tissues of the body. Ngayon, altered yon sa malignant cells. Kaya ngayon, magkakaroon ng clearly defined altered cell na magiging tumor. Yung differentiation. If undifferentiated, so ibig sabihin, hindi clearly defined ng body yung malignant cells or new cells na nag-form due to the cancer, nagiging undifferentiated siya. We call that anaplastic cells. Kapag ganun, mas hindi clearly defined, mas kalat sa katawan, at dahil hindi nakikita ng katawan kung alin yung mga cells na yon, kaya hindi niya na-fight at mas dumadami, mas nag-proliferate, nagme-metastasize, mas naging worse yung prognosis. So transformational changes of normal to undifferentiated tumor cells are the result of the interaction between a person's genetic factors, categories of external and internal factors. So basically, itong mga factors na to yung mag-point out kung gaano ba kalala yung cancer na meron yung isang patient. So genetic factors, depende yun sa patient mismo kung mayroong history sa kanilang DNA. Other factors, like external factors, for example, are physical carcinogens like ultraviolet and ionizing radiations. Pwede mayroong chemical carcinogens na exposed yung patient natin like asbestos, tobacco, aflatoxin, and arsenic. So depending on the food and the drink that they eat, and usually depending sa environment itong mga to. And then biological carcinogens like virus, bacteria, or parasites na exposed previously yung ating patient. Other external factors include yung hormones. Um, Probably ang hormones na meron yung isang patient kapag um, increased yung hormonal output, most probably mas magiging worse yung cancer na meron yung patient. Especially kapag nag-receive ng specific hormones yung new cells na nag-form due to the cancer. Some um, immune conditions like meron siyang immunosuppressed condition or meron naman siyang um, other conditions na nagpe-predispose na maging immunocompromised yung patients at risk sila magkaroon din ng cancer. And other inherited mutations due to the line. So, totoo yun na meron talaga tayong kapag merong family history, yung isang patient na sinususpect, most probably, ina-expect natin na at one point or another, magkakaroon siya ng cancer. I know of a specific line nung college ako, nung high school friend, lahat ng women sa kanila nagkaroon ng breast cancer at different and varying degrees. So, this is quite true, at least for me, sa internal factors for cancer. Now, we know that there is no definite cure for cancer like fever. Bigyan mo ng paracetamol, most probably meron tayong gamot na mabibigay para mawala yung fever. For cancer, wala. Pero meron tayong prevention and then control of new symptoms kung meron. As with as with other diseases, a patient may be considered cured kapag wala ng evidence ng cancer. So, for diseases kasi, para mas maintindihan natin, for diseases na wala tayong definite cure, so na kapag tinake mo 'to mawawala completely yung gamot. Hindi kasi natin sure, especially for anaplastic types, kung meron ba talagang cancer o wala. Kasi hindi natin sure kung hindi natin ma-detect. So, we base our treatment on the evidence kung meron ba siyang nakikitang cancer cells or wala. Usually through MRI. Kapag wala at walang evidence, yung blood work niya ay clear, at technically wala na tayong makitang any evidence of cancer, we call those patients na they are in remission. However, we know na dahil remission siya, most probably, yung iba, naging completely cured na, nawawala na talaga, especially kapag hindi malignant. Pero kapag alam natin na malignant yung cancer, kahit in remission siya, after a few years, most probably lalabas na ulit siya. Hindi dahil nagkaroon ulit siya ng cancer, pero nag-die down lang a bit yung cancer cells, tapos nagkaroon ulit um, ng pag-attack doon sa patient. At least medically, yun yung cancer treatment. Ngayon, ito yung mga specific list ng treatment medically na na-receive ng patients para um, matapos or gumaling sila doon sa any type ng cancer na meron sila. These are their medical options. So, hindi pa tayong physical therapy, ha? So, primarily, the root cause, which is cancer or neoplasms, ano yung mga treatment na ina-apply ng medicine. So, of course, early detection. If you detect it early, mabigyan mo ng other therapies for the cancer, most probably, mas malaki yung chance na babalik tayo. Vaccination, primarily for other bacteria and parasites and other viruses na especially human papilloma virus, Hepa B, and other viruses, pwede tayong magpa-vaccinate for that. Surgery naman, kapag meron na tayong tumors or meron tayong mga other um, neoplasms na kailangan ng i-reset. So, usually, ginagawa yun at any part of the body hanggang medically possible siya. Radiation is a big part ng cancer treatment alongside with chemotherapy, hormonal therapy, and immunotherapy. Primarily, itong mga to, ang ating pinaka magiging metaphor with this is surgery is like cutting off the dead parts, but not really identifying which parts are problematic. So dahil new cell growth, ito, nangyari neoplastic at talagang metastatic, pinutol mo, pero parang kabuti, tutubo ulit siya. Hindi natin sure kung nakuha na lahat, kaya hindi natin sure kung patay na lahat ng mga cells na problematic. For chemo and other types of therapy, ang ginagawa ay lahat ng cells sa katawan ay itatry niyang i-fry. So, i-fry meaning pahinain yung immune system para ngayon mapatay yung mga neoplastic. So, ang common metaphor ay kapag mayroong problem sa bahay, giniba mo yung one section, yung for example, yung isang bahay ay may anay, pag giniba mo yung one section na may anay, yun yung surgery. Pero hindi ka sure kung lahat ng wood sa bahay may. Ngayon, yung chemotherapy, ang ginagawa mo, parang yung buong bahay ay nilalagyan mo ng pest na lason. Para ngayon, sure ka na yung part na yun, yung area na yun ay problematic pa rin, pero lahat ng part na probably ay merong problema or may anay, ay sabay-sabay mawawala or mapapatay yung mga problematic cells. So, magandang metaphor yun kasi ganun din yung effect. Paano yung mga good parts or yung mga parts na wala namang anay dun sa bahay dun to continue that metaphor? So, ang nangyayari ay na-affect din sila. Kaya ngayon, generalize yung kadalasan ng mga symptoms na nakikita natin for patients with. So, right now, where do we come in? Diba? Kasi lahat ng ito ay medical symptoms. And we come in through palliative care. Primarily, palliative care, especially for physical therapy, we focus on cancer-related symptoms and help alleviate them for the patient. Medical talaga yung patients with cancer. Surgical, yung primary na kailangan nila for other types na merong tumor. Pero primarily, yung mga other physical impairments and activity limitations na meron sila, that's where we come in as PTs. Specifically, fatigue, dyspnea, insomnia, pain, weakness and atrophy, loss of appetite, diarrhea, nausea, lymphedema, decreased physical function, and poor QOL. Other functional problems also are psychological issues, thrombocytopenia, osteoporosis, metastatic fractures and compressions, and then most of them are immunocompromised. So primarily, kung makikita ninyo, lahat ito ay mga medical symptoms na halos lahat merong physical symptoms which are given to you on the first slide. So, kadalasan ito yung meron tayong effect for the patient. Kasi kailangan, at tatandaan nyo, halos lahat ng patients natin na may cancer, hindi sila tumitigil ng gamot. hindi sila tumitigil ng chemotherapy, sabay tayo doon sa primary na gamot nila, which is chemo and other types of medical solution. So primarily, what we can do to help is help alleviate these symptoms that lessen their quality of life. Hindi ito katulad ng musculoskeletal pain na tayo yung primarily nagiging kanyang gamot. Medically, they give pain symptoms, pero we correct movement, we correct biomechanics, we correct how the patient moves, para ngayon, hindi na mangyari yung micro or macro trauma or makarecover yung patient. Dito, primarily, we are helpers for the patient para ngayon mas maging better yung quality of life at any point of the cancer. So right now, the main question that we must ask ourselves is kung ganun pala na secondary tayo, hindi tayo primary na nagli-lead sa team, where do we come in? How can we help as physical therapists? How can we improve yung quality of life? And as healthcare professionals, how can they benefit from the treatment that we give? So primarily, ang goal natin ay to regain and improve physical function, aerobic capacity, strength, and flexibility. Ngayon, ang question natin sa atin ay if progressive in disease, kunyari metastatic, can we really improve pa and regain pa yung mga previous function? Primarily, the answer is what we want to do is there's a certain level of physical function that we get our patients in the clinic. So, sabihin natin nandito siya. So, pagdating sa'yo, most probably after whatever happened, bababa yun, and gusto nilang bumalik yun. For common diseases, yun yung gusto natin, ma-regain at ma-improve pa. But for them, yung initial nila na level, bumaba, pero yung potential nila, most probably, mas baba. Kaya ngayon, kailangan mo lang bumalik doon sa potential nila. Ang problema for progressive diseases, yung initial function nila, pagbaba na po. So, ang goal natin, mapigilan yung pagbaba at ma-maintain lang siya for as long as possible doon sa level. At huwag nang i-risk na i-progress or improve ba. Ngayon, that's not to say that we do not want to improve our patients if they have progressive diseases, but it's just to be more realistic in our treatment protocols. Primarily kasi, if progressive in disease, ayaw naman natin na gagawa natin siya na unrealistic goal na hindi, kaya pa natin bumalik pa sa kung ano yung meron ka at higit pa dahil dumating ako. So, that's an unrealistic view of what we can do. What we want to tell the patients is, and primarily, for most of the patients na mayroong cancer na makukuha ninyo, specifically progressive yung cancer nila, we just want to maintain what we have now for as long na nandito ka under my care. However, hindi naman lahat kasi ng patients na mayroong cancer progressive. Yung iba, hindi malignant, lumaki, pinutol, nagkaroon siya ng problema, most ng mga GI problems, ganun. Pagka-resect, inayos yung kanyang medical problems, nakakain na siya. After nun, mariregain niya yung previous na function. So, other cancers are like that. Yung nasabi natin kanina, apply that for any type of progressive disease or yung mga merong long-term disability na expect natin. Other goals natin is to improve quality of life, improve body composition and body image. Primarily, sa quality of life, hindi hindi lang kasi physical yung problem, pero mentally, psychologically, spiritually, nagkakaroon ng doubts yung patients natin. So, we have other interventions na pwede nating ma-improve para yung overall quality of life ng patient natin mas mag-improve. And in terms of body composition and body image, kadalasan ng mga patient natin pumapayat ng sobra. So, for iba, that's, yung iba mas gusto nila mas payat sila. Yung iba naman, 'di ba, na ang nangyayari kasi maging sobrang sobrang payat. Kahit kasi gusto mong payat ka, yung amount of weight loss na makikita mo would be very, very severe for some. Kung gusto natin, through exercise, ma-delay yung unnecessary atrophy at kung magkaroon man ng body image issues yung patient, ma-refer natin siya sa psych. Pero kadalasan, ma-delay natin yung pag-waste ng patient. We also want to improve cardiorespiratory, endocrine, neurological, muscular, cognitive, and psychological outcomes. Mas mag-delve into tayo kung ano ba talaga yung na-improve natin per specific PT management na gagawa natin. Potentially reduce or delay recurrence or secondary primary cancer, and reduce, attenuate, and prevent long-term and late effects of cancer treatment. Primarily, ang ang gusto kasi natin dito, it's to um we just want to maintain the function for as long as possible in any system of the body. And then dahil nagma-maintain tayo, technically long term wise, kakaroon tayo ng better outcomes kasi hindi um steadily nagde-decline because of our treatment.